Thank you very much, Cahir. I think from the contributions that we've heard today, and indeed from the passionate one of my colleague just there, the HSE's reputation, the brand HSE, is a damaged, uncredible brand that people have very little faith in. And that's not to say that the staff who work there are branded with that, because anybody I ever deal with or talk to, whoever is admitted to hospital or deals with the health services, never does anything but speak extremely highly of the people who deals with them in their care. And I just want to put that on the record. But the organisation and its structure, how people interact with it, the way it's administered and the way the bureaucracy operates, is something that infuriates people and is causing severe problems and severe issues for people across the country. Which is why I welcome the bill, and I think the bill is a step in the right direction. I would like to see the bill, as it is indeed it is intended to do, being a step along the way to the universal health insurance model. And I think that of all of the things that this government has put in as a priority, and that is in the programme for government as being something that needs to be done, and one of the reasons I support this government so strongly is because of our intention and our desire and our plan to introduce universal health insurance, to finally take economics, ability to pay, your personal circumstances out of your access to healthcare. That for anybody in this country, regardless of who they are, what background, what situation they're in, they will never have to worry about the money in their pocket when they're getting access to health insurance, access to healthcare. And I think if we achieve that in this term in government, we will have achieved something monumental. And it's one of the things that I'm particularly proud to support this government in its pursuance of. I think the number of problems with the HSE structure, and a number of them have been alluded to probably more eloquently by Deputy Penrose. But the accountability of money, where the money goes in. Just today, I was having a discussion with the HSE West about allocations for disability services. And it is my understanding that there has been a national pot of money allocated for disability services, that the cut, the reduction of 1.2% was negotiated nationally and is working its way down. But that budget, as it has been allocated, is being interpreted differently in the different HSE regions. So much so that I haven't got a figure yet for what the cut will be in the HSE West, but that it may in fact differ from the figure that was negotiated nationally. So the idea of the directorates, where the money goes through to a single directorate, so that the disability budget goes to the disability directorate, and the disability directorate distributes the money and allocates the money, monitors the money, and makes sure it's getting value for money from the funding, I think is something to be very welcome. I also think the fact that we're getting rid of this fake corporate veil, which is what the HSE was. It was, in my view, used as a way to give the Minister for Health the opportunity to say, that's not my problem, that's the HSE, to create an artificial wall between those who are responsible for the health service, which is us, which are us as public representatives and as a government, with the corporate entity that we could blame and lay the accountability at the floor of them. And that needs to change. And I think that this is acknowledged by the Minister and his department as but a step along the way to the complete abolition of the HSE, and I welcome that. I just want to talk a little bit about something very positive that I think has happened in the health service. And I want to give the Minister credit for it, because he gets a lot of knocks, but this is something that I think he does deserve a lot of credit for. And it's the way in which the health service in Galway has been transformed. Now, it's transforming very positively as part of a Galway and Roscommon hospital group. There's a new CEO, Bill Maher, who came from St. Vincent's, Tony Canavan, who I would know down in Galway, and they're working extremely hard to change the entire management concept with how the hospitals are run. They now have a network of 4 hospitals. They have Galway University Hospital, Merlin Park, Porty Uncula in Ballinasloe, and Roscommon. And rather than just saying that every hospital has to do every service, they're saying that Galway is the acute centre, Merlin Park is the step-down centre, Roscommon will be responsible for other functions, and so on. And they're using their facilities, they're using their resources cleverly. And it's something that we haven't had before, this clever and proper use of resources. And they're also introducing something which anybody who's worked in the private sector, or even in cutting-edge public service bodies, should have been in a long time ago. Key performance indicators, tracking what they're doing, having management plans, having targets, having clinical directorates where the actual people who are working in the service sit down with the staff there and they put together plans and they make sure they follow through in them. And believe it or not, the people who are most impressed by this and are most heartened by it are the staff, because they've worked for so long in a leaderless environment. It was often said, and it was to the shame of the previous government, that Galway was the worst run hospital in the state. And now it's turning that around, because it's putting in place a proper plan, proper management, looking at how they're achieving things. And some of the changes that have happened in such a short period of time. This government is only 2 years old. Despite a massive increase in emergency department activities, Galway is the second busiest emergency department in the country. The trolley times are down significantly. They're not gone, but they're down. The progress is being made. The inpatient targets, Galway had one of the worst records for inpatient targets. This year they hit the 9-month target, and they're on course to meet the 8-month target in June 2013. The outpatient targets, they're going through their outpatient lists. Simply by going through the list, there's 43,000 people on the outpatient waiting list for Galway. Just by going through them, they're able to take 3,000 off, by simply going through and analysing what they're on it. And there's a lot more to do.
Deputy, you have about 3.5 minutes, almost 4 minutes left, but it is now 1:30. So could I ask you to, you're in possession, but I could ask you to move the adjournment of the debate.
Seconds if you want, Chair.
Well, I think maybe
okay, I'll
we should
adjourn.
adjourn, because it is time. If you move the adjournment.
I move the adjournment.
Thank you.